Thanks very much, Julia. Am I heard or do I need to get the microphone? I have a loud voice. Anyway. Okay. All right. Thank you. Thanks very much for the introduction. And I think as Julia introduced my work, I would say I'm probably the least expert in the healthcare field. My studies in healthcare are much more limited compared to those dinosaurs. Not dinosaurs, like dinosaurs. Actually, in terms of the shape, giants. My son is obsessed with dinosaurs, well, not with giants. I'm really sorry, but I meant giants. All right. I would say my research interests are more broadly on the impact of AI on professional work. I think I have more to say, let's say, about what we can learn, what I think is fascinating from the healthcare context in that sense. And I would say more particularly, specifically, me theoretically, I'm drawn into theories of knowing and of knowledge collaboration. I'm interested in how knowledge is produced, shared, and used in organizations. And I think, especially for that, looking at AI in the healthcare context is particularly interesting. If I look at the overall debate around how AI is affecting, or more likely is going to affect, let's say, professional work, I'm happy to say that we're sort of past this sort of, let's say, what I think at least is a bit of a reductionist view of augmentation versus automation. I think we're much more interested in trying to identify the intricacies, the nuanced ways through which AI is blended with the different ways of working, and thinking of those intricacies. I think that's one of the reasons why the healthcare context is particularly interesting, because you have professionals who, at least from my limited experience and from the studies that I've read as well, it's not the typical response to a new technology being introduced where they will resist, right? We're past that black and white, I think, thing. They're appreciative of computational methods. They're appreciative of using evidence, and at the same time, I think they're quite likely, and I've seen that in studies, they're quite likely to question the models, to question where the data comes from. They want to understand what it is that they have in front of them and how they can use these insights. Maybe I should clarify that I'm particularly referring to frontline work AI using Angela's categories, right? But they're definitely more interested in thinking about, okay, where these insights, what do they really tell us? What do they mean? How can we make use of them? So they want to understand where exactly those insights come from. And they will come with sophisticated questions. But from what I've seen so far, that doesn't necessarily mean that they are ready to make use of it. They're more likely, they're going to end up in situations where it's just hard to understand. And why is that? Because, again, it comes back to knowledge and to knowledge boundaries. It's not easy for the, what I would call digital natives, computer scientists, data scientists, to clarify how the model works in a way that other experts can understand. And at the same time, quite often we see the other way around, right? Where the computer scientists, they may have deep understanding of the technology, deep understanding of how to develop the algorithms, but not necessarily then the necessary domain knowledge that they need to really contribute with sophisticated insights. So there's sort of like, let's say, get lost in translation. That's what I saw, for example, in a project I did with one of our MPhil students at Cambridge last year. We looked at a team of clinicians who wanted to implement, they wanted to create actually an AI-based algorithm for transplant care to support decision-making in transplant care. So they came together with computer scientists in the university setting. So everybody was sensitive to research. Everybody was willing to contribute, but they constantly felt they could not just, they literally mentioned, we're speaking a different language. we are speaking about transplant wait lists, and those guys are just speaking about queues. We literally cannot understand each other, and they could not move past the stage of being willing to figure out a way to speak together. So I think identifying how they navigate those challenges, how they navigate those tensions, in order to be able to come up with something that makes sense to everyone, to come up with insights that they can actually understand where they come from and make use of them. This is a big challenge in front of us, which definitely needs to be resolved for the healthcare setting, thinking of from the practice perspective. But at the same time, there's lots of interesting ways through which we organizational scholars can learn from this and transfer to other professional work settings as well.